Hi, this is Dr. Adam Goodman, and I want to talk to you about a SureSmile. It's a technique that makes orthodontic treatment dramatically faster and more predictable. Here's a patient who came in with quite a bit of lower crowding. Notice how this tooth is locked behind the other three. This tooth is slanted. On the upper, there was moderate crowding with one tooth set quite a bit back. The side teeth were pushed in, so the arc was somewhat concave. Now, the patient preferred Invisalign, but was willing to consider traditional braces if it could be done in a pretty quick treatment interval. We estimated with SureSmile this would take about 6 months, which is dramatically faster than conventional orthodontics. So what we do with SureSmile is we scan the mouth, and that renders a computerized image of the patient's teeth. Now, what the SureSmile technicians have done, if they have given me perfect alignment of the teeth with perfect angles and perfect torques. So here are the lower teeth perfectly aligned. This is going to be my end result when we finish treatment. And here's the upper. Now, this is all well and good on a computer screen, but how are we going to get this patient's teeth to line up in the mouth like this? Well, here's how the technology works. We scan the patient's mouth with the braces on the teeth. We've placed the braces by hand. We've scanned the mouth after the braces are placed. Now, no orthodontist can put brackets 100% perfectly straight, and because of that, there are certain adjustments that the orthodontist has to make, but those adjustments are dramatically reduced using SureSmile. What happens is we are given wires that are bent by a robot. You can see the wires here. This is the image that I'm going to approve, and the wires have very specific bends on them. I'm going to show you the wire in a second to remove the teeth. Let's remove the braces. Notice the bends that are in these upper and lower wires. Now, orthodontists are able to place these without SureSmile manually, but there's a human factor. Sometimes it bends a little bit too much. Sometimes it's not quite as much as needed, and because of that, treatment time really can accumulate. With SureSmile, we have precise predefined positions that are placed into a wire that is bent by a robot, and the wire is made of a high-tech material that can't even be bent by human hands at room temperature. So here's our patient only 6 months later. Notice the perfect alignment of the teeth, the perfect angulations of the teeth. Here's the upper arch, perfectly symmetrical and round. Here's the lower arch, lined up very nicely, no more tooth that was shifted way back. And just to remind you, here are the beginning pictures where you see severe lower crowding, narrow arches, and upper tooth that was set back. This was done with SureSmile in 6 months. And if you notice, look at the patient's smile beforehand. And I'm going to show you the after. Look at how light reflects off those teeth once they're straight. This was done with SureSmile. This case was 6 months. At most orthodontic offices, this case would take anywhere from 15 to 20 months.